If you click on the cardiovascular sensor, you come to this section, and this is essentially everything about heart disease and associated factors that influence the risk of heart disease. Now, in the introduction, you will find some general information about cholesterol, triglycerides, the different blood parameters that, if suboptimal, increase your risk of heart disease. It will also tell you about the good and the bad cholesterol and the problems with arrhythmia. So when the heartbeat is irregulated, often through genetic variations. So do read through this in case you're interested. This is general information, and if you want to know the results of your own genetic test, you have to click on Summary of Effects. So this is essentially all of the information that we could collect from your genetic test. We analyzed a multitude of genetic variations here because there are so many genetic variations that influence different aspects of cardiovascular health. And this is a quick summary. And I'm skipping over this section. We can come back to this in a second. So you will find a number of bars, and each bar will tell you your relative risk in this area. So for example, the first question, your risk of coronary heart disease, atherosclerosis and heart attack. So essentially all of the cardiovascular diseases together might be average risk if your bar ends right in the middle. Average means the same risk as the whole population. It might be increased, like in this case, it could be up to here, which means that a lot of different genetic factors all are suboptimal and increase the risk. So in total, the risk is much higher than that of the general population. Or you might actually have fewer genetic risk factors than the general population, in which case you would be down here. So your genes would actually be a protective effect for you. So reduce your risk compared to people around you. So this bar essentially tells you the importance of cardiovascular prevention, and the higher it is, the more important preventive measures are for you to stay healthy. Then going on to the next, your LDL cholesterol levels are likely to be. LDL cholesterol is a low-density lipoprotein cholesterol, and this essentially is the bad cholesterol. So you want to have very low levels of this kind of fat in your bloodstream. And the genetic profile of this example, of this person, show that the LDL cholesterol levels are likely to be increased due to this person's genetic profile. And you can check your own results. If you're up here, it means also your genes predispose you to very high LDL cholesterol levels, and you might find that in a blood test. And it's important to counteract this genetic predisposition. Or you might be down here in the normal level, in which case it's more likely to be normal. Next, your HDL cholesterol. HDL cholesterol is the good cholesterol, the one that you want to have in as high levels as possible. Your HDL cholesterol levels are likely to be normal or low. So low would be bad in this case. So if your arrow is somewhere around here, that's good news. So that means your genes regulate your HDL cholesterol well. And if you're here, you unfortunately have genetic variations which interfere with good HDL cholesterol levels and predispose you to a higher risk of heart disease. But we will later talk about how to use this information and to counteract the genetic variations or genetic predispositions that you have. Next, this is a very important and very interesting aspect, the effect of omega-3 fatty acids on HDL cholesterol. Now, omega-3 fatty acids are typically in fish oil capsules. So what nutritionists or doctors would often do is, if your HDL cholesterol levels are too low, so if they're in the bad range, they would prescribe you omega-3 fatty acid supplements. They would say eat more fish because that contains a lot of omega-3, and the supplements are usually fish oil capsules which also contain omega-3. There are also some plant-based omega-3 sources, and these are usually prescribed to improve cholesterol. Now, What often happens, and many doctors and nutritionists are aware of this, is that in some people it helps, and in some people it actually makes the problem worse. And genetic scientists have found out why. There is a specific genetic variation called the ApoA1 gene. And people who carry a certain genetic variation in this gene actually have the opposite effect of omega-3 fatty acids on HDL cholesterol. So it might help one person, and depending on if a person has this genetic variation, it might make that person's risk of HDL cholesterol or the level of HDL cholesterol worse. So this will tell you, is it a good idea for you to eat a lot of fish and take supplements with omega-3 fatty acids, or is it actually counterproductive with respect to HDL cholesterol? Next, the triglycerides, which is also a type of fat that circulates in your bloodstream. They might be normal or increased. Again, you want normal levels rather than high levels. So genes might predispose you. If you're here, your genes are predisposing you to very high levels. If you're here, your genes are regulating them correctly. So in this case, this person is somewhere in the middle, and again, this person would have to take certain nutritional and preventive measures to try and optimize the triglyceride levels. Next, another substance that circulates in the bloodstream is homocysteine. Similar to bad cholesterol, it increases the risk of cardiovascular disease. So you also want to have low homocysteine levels. And in this case, it's increased. So genes predispose to higher homocysteine levels. Now, there are some nutritional interventions, ways that you can intervene through nutrition, through the types of things that you eat, and specifically supplements in this case, because homocysteine is very strongly regulated by folic acid. Folic acid is a common nutritional supplement, as well as vitamins B6 and B12. And these supplements can actually reduce your homocysteine levels, especially if homocysteine is genetically misregulated and too high in the bloodstream. Then the effect of vitamin B2 on homocysteine. Now, usually people or clinicians consider vitamin B2 not effective in lowering homocysteine, and this is usually correct unless a certain genetic variation is present, and this genetic variation actually changes the effect of vitamin B2 on homocysteine levels. So if a person has this genetic variation and takes vitamin B2, it can lower this person's homocysteine levels as well. So depending on the genetics, homocysteine levels might be high, then folic acid, vitamin B6 and B12 are effective interventions, and vitamin B2 only if this genetic variation is present and is actually beneficial to lower homocysteine as well. Then the effect of aspirin on arterial thrombosis. Aspirin is usually considered to be a headache pill, but it also has blood thinning properties. And there are different types of disease problems called thrombosis, where a blood clot can form in the bloodstream, and if this blood clot is then jammed into any part of the bloodstream and blocks up the blood supply to a specific tissue, this could, for example, in the brain cause a stroke, or in the heart cause a heart attack, or in the lung, that's probably the most severe type, it can cause lung embolism. So this is thrombosis, and aspirin has actually been shown to be effective in preventing it, but genetic variations again changed the effect of aspirin in this effect. So some people benefit from aspirin to reduce the risk, the likelihood of thrombosis from occurring, and other people do not have this benefit from aspirin. And depending on where your bar is, in this case, this person has this protective effect, but this person might not have this protective effect. And if this is the case, and a clinician would usually prescribe you aspirin as a thrombosis prevention, he might want to choose an alternative drug because this protective effect is unlikely to be gained from aspirin. And then finally, the risk of sudden cardiac death, which is essentially a spontaneous heart attack. This is associated to what we call the QT interval. So you might have seen in television a heartbeat is on these medical machines. It goes up and down, and it has this typical shape. And a certain part in there, in this shape, is called the QT interval. And some people have a genetic variation which causes this interval to be longer. And the longer this interval is, the higher risk of sudden cardiac death exists. And there are certain drugs which also make this interval longer. So certain people who already have genetic variations which make it longer should really be aware of this, talk to the doctor before they get any drugs that make this even longer to reduce the likelihood of a sudden heart attack. So depending on where your bar is, it might be in a normal range, it might be in an increased range, or somewhere in between. This is more or less important for you to consider. Now coming back to the top, this is a quick summary. So this summarizes all of the things that you've seen below that we just talked through. So compared to the average person, you have a 2.7 times higher risk of coronary heart disease. This means you have an almost 3 times higher risk of developing coronary heart disease than other people. So in this case, for this example person, it's very important to take preventive measures. This person also has a high predisposition of high LDL cholesterol. Do check this page on your own profile to see what applies to you, so these things are likely to be different. This person also has a slight predisposition for high triglycerides. Vitamin B2 does not lower homocysteine levels. Omega-3 fatty acids do improve HDL cholesterol levels. Aspirin is effective in preventing thrombosis. No predisposition to low HDL cholesterol levels exist, and predisposition to increased QT interval duration exist in this case. So this quickly summarizes all of the things that you can find underneath. So this is all of the kind of information that we can gain from your genetic test, because we analyze so many different aspects of your cardiovascular health. And now, knowing your personal risks and knowing how you respond to certain interventive measures, such as aspirin, we can now make a personalized prevention plan. So take these data into account and help you prevent any cardiovascular problems and change your response to certain things. And the prevention part is back here. So you click on prevention. And this here is very personalized. So in your section, you will likely see different texts here than in this example. I will quickly talk you through this example, but definitely do go back to your own account or to your own booklet and check what the specific prevention recommendations are for you. Regular exercise is one of the most important lifestyle aspects of cardiovascular health. So specifically, if you have a high risk of cardiovascular disease compared to other people, it is important that you have an extensive exercise regime. The optimal would be, in case you can manage it and fit it into your time plan, would be 5 days a week for 30 minutes. Smoking is also a very big risk factor. Smoking is never healthy, but especially if your risk of cardiovascular disease is above average, you should really reconsider to give up smoking, because it increases your risk even higher. These risks multiply with each other and increase your risk of cardiovascular disease. Alcohol consumption can also have a big negative impact on cardiovascular disease. So alcohol should only be ingested in moderation, and the meals that are eaten should generally be low fat. And if they are fatty, they should be the healthy fat. So polyunsaturated fatty acids are recommended. And typically these are in fish, poultry, lean meats, and you should avoid fatty meals like sausages, bacon, fat cheese, and so on. When eating dairy products or milk products, it's also important to look for the low-fat alternatives. They usually taste the same and also have a beneficial effect on your cardiovascular health in this case. Animal products should generally be reduced. Vegetable oils are more recommended, and especially for people predisposed to high risk of cardiovascular disease, eating fruits and vegetables multiple times a day is highly recommended. And as I've discussed before, omega-3 fatty acids, fish oil capsules or fish, have a different effect on different people depending on the genetic variations. So do check your own results. In this case, the person has omega-3 fatty acids are usually recommended for high cholesterol, but for certain genetic types it can also worsen HDL cholesterol. Based on your genes, omega-3 improves your cholesterol levels, so in this case omega-3 fatty acids can be recommended. Then the QT interval, which is the interval change in the heartbeat, which can cause sudden cardiac death, might be increased based on your genes, so do check your results. And there are certain drugs that would be warned against, especially if you have a high risk of sudden cardiac death through QT interval disruptions. There are certain diseases or risk factors under which circumstances it is necessary for you to talk to your doctor to have your QT interval measured and for appropriate steps to be taken. In this example, it would be circulatory disorders, type 2 diabetes, metabolic syndrome, which is being severely overweight, or the age over 55. And certain drugs, as I said, can also increase the QT interval. So for people with an increased QT interval, it's very important to talk to the doctor about this to make sure that if certain drugs are administered, that you might be able to choose a different alternative to this drug, or to measure the QT interval and observe it medically to see that it remains in a normal range. And here is a whole list of drugs that are known to change the QT interval. So in case this is a risk, do talk to your doctor about it to make sure that he can modify your drug dosages. Under no circumstances should you stop taking a drug or change a dose of a drug based on this information. This should only be done by your doctor. So please talk to your doctor if you are taking one of these drugs to give him the chance to modify your dosage or selection of drugs. So this is the whole list of preventive measures that were recommended for this person. They can be different for you, so do check your own report for this. And if you follow these recommendations, for one, you significantly reduce your risk of cardiovascular disease. You use specific information such as if omega-3 fatty acids are good or bad for you. And if it ever occurs, you will also be able to find out which types of drugs are more effective, which nutritional interventions are more effective, and this will help you maintain cardiovascular health. And should you already suffer from cardiovascular disease, it will also help you manage it more effectively.